Hello, I'm Mitch Rowe, the Secretary of the Family and Social Services Administration. Today, conversations about public programs often blur a simple truth. Rights and benefits are not the same thing. Rights protect us from government overreach. Benefits, on the other hand, require responsibility from the state and from the people who receive them. There's an important reality about healthcare in the United States. Most Americans receive their coverage through work. Staying connected to work, school, job training, or services isn't unusual. It's the backbone of our entire system. People who stay connected are more likely to keep their coverage, seek preventative care, and build long-term stability. That's why aligning the Healthy Indiana Plan with these pathways isn't harsh. It's common sense. Indiana's Medicaid program supports two very different groups. First, and frankly, most importantly, people who cannot participate in the workforce, children, people who are aged, blind, or disabled. They receive coverage because dignity demands it. Second, adults who can contribute, but may not be able to afford healthcare coverage on their own. And for nearly 20 years, the Healthy Indiana Plan has been built around a straightforward expectation. The state will meet you with care, but you have to meet the state with effort. From the beginning, HIP asked members to take small steps, like modest monthly contributions, and these steps mattered. They led to more preventative care, better appointment follow-through, and more engaged members. Responsibility didn't weaken the program, it strengthened it. Now, Indiana is applying the same principle to HIP work requirements. Able-bodied adults ages 19 to 64 who are not exempt must complete 80 hours a month of work, part-time education, job training, or volunteering, or any other combination that fits their lives. The design is flexible because real life needs to be flexible. The state built broad exemptions to protect those who should not be subject to these requirements: caregivers, people who are medically frail, and those who are on substance use disorder programs. Critics say work requirements block access to care, but Indiana's own experience shows that programs built on participation, on real engagement, produce better outcomes and stronger public trust. Indiana isn't leaving people on their own. Work One centers, hospitals, Ivy Tech campuses, libraries, and community nonprofits will provide hands-on help. Information will be clear, consistent, and easy to follow. HIP was created to support the working poor. This mission hasn't changed, but the public benefits only when everyone does their part. Indiana can offer coverage, guidance, and support, but only the members can take steps needed to keep their benefits. Maintaining eligibility isn't a passive entitlement, it's an act of responsibility. And that's what keeps the program fair, credible, sustainable for the long term.
To learn more about HIP work requirements, be sure to check out our other videos. You can also find more details and the most up-to-date information about HIP work requirements at myfssa.in.gov. If you haven't already, please create a benefits portal account. It's the fastest and most reliable way to stay informed about your Healthy Indiana Plan coverage. Staying eligible is your responsibility, and we appreciate your commitment to staying eligible for the Healthy Indiana Plan.